The city of Memphis started this work just a few weeks ago. The disparity has changed a little bit. There was approximately 2 weeks ago, about 20% of the total vaccinated population was African American. This week it's approximately 30%. So that's certainly not victory. That's just a step in the right direction. So we are, and we do believe that opening the fixed sites in Whitehaven and in the Raleigh area are helping with that. And then there is a limited number of fixed sites that you can operate at one time just from a capacity perspective. So 5 we think is a good number for our community based on the number of vaccines and the efficiency. Then the pop-ups, I don't mean to minimize them. This is not a light adventure. This is a serious undertaking. So for instance, we will do in 2 days in the Fraser area more than 2,000 vaccinations. And then if I failed to say it also when I was making my previous comments, next weekend we will do another pop-up in Fraser because we know that that was one of the areas that had the lowest uptake. So fully over the next 2 weeks, an additional 4,000 focused right on that area. So doing the pop-ups gives us the ability to be precise and pivot and go where we see the lowest uptake. The probability of another fixed site, there have been some proposals. We are seeing what the flow of vaccine is right now, but today the capacity in the system that we have is best optimized by having the 5 fixed sites, and then each day we're doing at least 1 pop-up. The one thing I would like to address is that I realize there are 5 fixed sites, 1 in Germantown, 1 in Whitehaven, 1 in Raleigh, 1 at the fairgrounds in the Pipkin building, and 1 in Appling. If you look at those 5 sites and then you draw a ring around each one of those sites, a 3-mile or a 5-mile ring, and then you look at the makeup of the population that live within those radiuses of those sites, when you add them all together, they reflect exactly the demographics of Shelby County. Approximately 54% African American and 40% Caucasian, and then about 6% other ethnicities and races. If you look at just the 4 sites inside the city of Memphis, so if you exclude the Germantown site, and then you look at the radiuses like a 1/2 mile or a 1 mile, it reflects exactly the demographics of the city of Memphis, approximately 64% African American, 33% Caucasian, and then 5% Latinx and other ethnicities and races in there. So the sites are representative of the community. The pop-ups give us the ability, because not everyone can get to the fixed site, to go to where people are that need it to increase that uptake. And I think gives us flexibility to partner with people in the community who are trusted and who are, have agency and can be the influencers, I guess, to use a term of art today from the social media, but influencers who can take people who may be on the fence and convert them over to vaccine recipients.